Humanism, an examination and analysis of client-centered theory. Client-centered theory is essentially about being compassionate, being open, and having a therapist that can have congruent values with the client, while also understanding the unique experience of that client based on their ecological environment. We have to take the PIE approach when implementing client-centered theory into clinical practice. This is also known as the person in environment theory. Person in environment is important because it emphasizes the understanding of a client and their behavior through examination of their ecological environment. A person's environment combined with their unique lived experiences will ultimately shape the client's worldview, how they think and respond the way they do. It's all about the pie. It's all about that pie for your client. It's all about that pie for your client. Here we examine Maslow's hierarchy of needs: self-actualization, self-esteem, belonging, love, safety, and physiological. The humanistic approach can be helpful for clients with depression, anxiety, panic disorder, personality disorders, schizophrenia, addiction, and interpersonal and familial relationship concerns. Specific types of humanistic counseling, such as person-centered therapy, have been found to be effective for interpersonal and relationship issues. Also, it's been shown to be as effective as CBT for depression. Applications for anxiety. The development of humanistic therapies for general anxiety disorder and other anxiety disorders may perhaps benefit from a focus on identifying how to mobilize clients' efforts to overcome avoidance and anxiety symptoms. Timulak 2018. Furthermore, humanistic counseling, in contrast to cognitive behavioral therapy, also recognizes that anxiety symptoms are superficial expressions of vulnerability that the client doesn't want to feel. Changing the way a client interacts with their environment may alleviate this anxiety over time.
Here we have the client-centered approach to panic disorders. So the goals are to reduce the client's symptoms to improve their mental health, understand the client's emotional and cognitive processes, and focus on improving the client's self-management. So overall, we want to reduce the client's level of stress and identify what causes it, what triggers the client's experience. And along with that, we want to collaborate with the client to help implement the utilization of healthy coping skills, such as grounding and breathing exercises, meditation. In addition, your role as a social worker is to focus on the fundamentals, which are self-actualization, congruence, unconditional positive regard, and focus on empathy as well. Next, we have the client-centered approach to personality disorders. When working with this specific population, you want to focus on the 3 phases of the client-centered therapy, which are to first create a safe and trusting relationship with your client. For the second, to learn and understand the challenges your client lives with and help build their self-image. And the third will be to address the client's feelings and vulnerabilities and collaborate with the client to develop goals. While using this, you really want to focus on your micro skills as a social worker. So that is focusing on body language, paraphrasing and reflecting on what the client is saying, being empathetic and understanding, make eye contact with the client, seek detail, which is ask questions to gain a better understanding and to overall summarize what the client is saying as well.
Humanism for schizophrenia. Gerard Holgarty combined humanism and science to implement what he referred to as passionate care, an intervention that assisted people with schizophrenia who were being reintegrated to society after hospitalization. In an outpatient study that followed nearly 400 randomized schizophrenic participants, it was discovered that participants improved in fulfilling their life roles after just 18 months of role therapy, proving that medication is not as effective without client-specific behavioral support. He also developed personal therapy, where the goal is to help reduce the relapses that occur in the 2nd and 3rd year after being released from the hospital by providing stress management techniques. Personal therapy was divided into basic, intermediate, and advanced phases to accommodate a wide range of patients adhering to client-centered theory. Client-centered approach client-centered approach to addiction recovery. Using the 6 models of addiction requires having an open dialogue with the client where they have the freedom to discuss their use and provide insight on the specific ways it affects their lives. The models help prevent the overgeneralization of addiction by subjectively using one or more of the models to understand and assist the client.
Strengths of client-centered practice. It allows the client to feel more comfortable and valued than other practices while treating the client as an equal. It is easy to gather lots of qualitative data. It focuses on transformative change for the future versus tension reduction in the moment. Below, you will see more words associated with the strengths of client-centered practice. Humanism and its clinical limitations. It relies solely on clinicians' experience with the client. It can be frustrating for clients that want people to tell them what to do. It is not as useful for a client with severe mental health challenges. It is difficult to form concrete treatment plans. It's individualized, so hard to draw conclusions or make generalizations for multicultural societies. It has been criticized for promoting narcissism.